Okay, so I want you to picture this situation. You're on your placement, the crash call has gone off, and you got to the patient, you're on the end of the bed, everyone's looking at you, and you freeze. Your mind goes blank. What's the first thing that you do? Now look, I understand most F1s in that situation freeze. And I don't blame them. I did the same as well. And the reason is because we're taught the mnemonic ABCDE. But we're never taught the system behind it. We don't truly understand why we use ABCDE in that situation. Right, so let's go back to basics. Why do we do A, B, C, D, E? Just a heads up, my handwriting is awful, but there's captions below, so you can pick up on what I'm saying. So with ABCDE, are we trying to diagnose the patient? No, we're not. The reason we do ABCDE is to identify any life-threatening problems, okay? We go one by one in this order. You do not go to the next one until you've stabilized the one before. So the first one is A. A is airway. So airway is pretty simple. Airway can either be opened or closed, so it's binary. And in the exam, they'll give you a hint. So if the patient is speaking in full sentences, you know that their airway is patent, so it's open. So if you're happy with airway, you can tick airway and move on to B. In real life, you need to listen more. So if the patient is snoring, then you know that there is a tongue obstruction. If the patient makes a gurgling noise, then you know that there's some fluid involved. So that could be blood or vomit. And then finally, you could also hear like a high-pitched wheeze, and that means there's stridor. So if you hear any of those three things, you know that there's some kind of obstruction, and that means you stop. You stop at A, right? You've identified that there's a problem at A. And unless you solve this problem at A, there is no point you carrying on to B, C, D, E. And this is what I meant earlier about making sure that you stabilize each level before you move on to the next. So with airway, we've identified the problem now. Whether that is one of the three things. So the first one, second one, third one. So snoring was the first one. Snoring was tongue obstruction. Second one, gurgling. That is a sign of fluid, blood or vomit. And the second one, yeah. And then the third one is stridor. So a high-pitched wheeze. So these are the three things you need to look out for when you're listening, right? You're at the patient's bedside, the patient is in front of you, and you listen out for these three things, okay? If it's in the exam, so if it's in your finals, they'll mention one of these three things, so you know that there is an issue with A. So you don't go on to B, you sort this problem out first. So, how do you sort out the airway? Because that's the important thing. You need to manage the airway now. So there's three things you can do to manage the airway. The first thing is head tilt, chin lift. So the reason you do that is because if you picture this pen as the airway and something is pressing down on it, right? Anything around it, soft tissue, tongue, anything of that sort, pressing down on it, and it's obstructing the airway so that air cannot pass through. You do the head tilt chin lift. I'm sure you've seen it in your OSCE teachings, and what that does is it removes the obstruction so the airway can fully open and it allows the air to flow through. So that's the first thing that you can do in order to manage the airway. The second thing is suction. So one of the other issues we mentioned earlier was things like blood or fluid in the airway, and that is producing the gurgling noise. So if you have blood or fluid, you use a suction to remove that, and that will clear the airway, and that solves that issue. And then the third thing is to use a nasopharyngeal airway, which basically is a tube that you insert that allows air to pass in and out so that you can maintain their airway. So now that we're happy with A, we move on to B. B is breathing. My handwriting is awful. Anyway, so for breathing, we first look at the patient. So when we look at the patient, we see whether they're using their accessory muscles. Are they using their neck muscles, their shoulder muscles? How fast are they breathing? Do they look very short of breath? These are questions we need to ask ourselves when we're dealing with B. Now, just looking at the patient isn't enough. We need confirmation. And where do we get this confirmation from? Numbers, right? You're doing the patient's obs or their vitals, and there's two parameters we look at. The first one being their SATs, O2 saturation. That's one. The second thing is their respiratory rate. So these are the two factors that we can look at to see how well the patient is breathing. So let's break it down. Why do we breathe? We breathe to get oxygen into our system. So what is the best way of checking whether we're getting enough oxygen into our body? O2 sat. Then we have the respiratory rate. If our body is getting enough oxygen when we're breathing normally, our respiratory rate will be normal. But if our respiratory rate goes up, we know that our body is trying to get more oxygen into our system. So these are the two parameters you need to look out for under breathing. And I hope you understand now why we look at these two parameters. Because when you understand it, in the heat of the moment, when your mind goes blank, you just go back to basics. So we're looking at breathing. Why do we breathe? To get oxygen. So what parameters do I need to look at? O2 sats and respirate. Now, if there's any problems with this, and the three main life threats you need to look out for, and this is just at the back of your mind. Remember, when we're doing A to E, we're not trying to diagnose the patient here. We just keep the diagnoses in the back of our mind. But at that point in time, when you're going through A, B, C, D, E, you need to try and solve the issue there. Not diagnose the patient, but if there's an issue with the breathing, you solve that. So if there's an issue with their breathing, their oxygen saturation will be low and their respirate will be high. So to solve that, you need to give high flow oxygen. But let's look at the main life threats. So the first one could be tension pneumothorax. Remember, this is just things you need to keep in the back of your mind as you're doing your A to E. The second one, a massive asthma attack. And then the third one could be a flail chest. So these are the 3 life threats you just need to keep in the back of your mind if you see an issue with breathing when you're doing your A to E. Now, like I mentioned earlier, the management at the level of breathing is simple. If there's a problem with breathing, that means your body is not getting enough oxygen naturally. So how do you solve that problem? You give the patient more oxygen. So the management is high flow oxygen. Simple. So now we're happy with airway and breathing, we move on to C. And C is circulation. So circulation is basically about the pump and the fluid. And by pump and fluid, I mean the heart and the blood that is circulating. So at the level of circulation, all you want to do is make sure that there is efficient circulation in the patient's body, which is maintaining their vital organs. So when you look at the patient from the end of the bed, so you've gone to a crash call, you're doing your A to E approach, you come to C, you look at the patient from the end of the bed. What do you look for? Are they pale? Poor circulation? Clammy? Have a feel of their peripheries? Are they cool? Poor circulation? Can't keep the peripheries warm? Have a feel of the pulse? Is it fast and thready? Indication of poor circulation. So when you come across these sort of things, this is just your initial inspection from the end of the bed. Okay? Just like we did for airway and breathing, you need to confirm that with numbers. So we look at the vitals. With the vitals, once again, there's 2 parameters we look at. So we want to know about the heart and the blood function, right? The pump and the fluid. So the first thing we look at is the pump, the heart. What's the best way of seeing the heart function? The heart rate. So if the demand is really high and the heart has to work harder, what happens to the heart rate? The heart rate goes up. Why is the heart working harder? Because there's not enough blood circulating around the body. So the heart has to work twice as hard to make sure that it can push that small amount of blood to the vital organs. The second one, blood pressure. So what is the blood pressure going to be like? You don't have that much blood in the circulation, so the blood pressure is going to be low. So if you're looking at a patient's vitals, their heart rate is high, their blood pressure is low, that is a sign of poor circulation. So we've identified the problem now. The problem is at C. So we stop at C, we don't move on to D, we try and solve the issue. So the high heart rate and the low blood pressure has shown us that there's poor circulation. And why is there poor circulation? There's not enough blood flowing around their system. So what do we need to do? What is the management? There's not enough blood. So what is the fastest way to try and increase the blood in their system? You need to give them fluids. So the first thing you need to do is insert 2 large bore cannulas. I don't know why I've just switched from uppercase to lowercase, but anyway. So once you've inserted the 2 large bore cannulas, you can give them a fluid challenge. So fluid challenge is basically a fancy way of saying that you're giving them a bolus, right? A short gush of fluid, and that's just to bump the amount of blood circulating around their body up. And that is exactly how you solve the circulation problem. Right, so we're happy with A, B, and C. So the fourth one is disability. So disability is essentially a quick brain check that we do. And there's a couple of things we do at this stage. You do the AVPU scale or GCS. So AVPU is alert, responding to voice, responding to pain, unresponsive. So that is a quick one to do. And then GCS is the other one where you look at eyes, voice, and movement. But I won't go into too much detail about that. You can just look up GCS on Google and you can see exactly the scoring system for that. But the relevance of the GCS is, if the GCS is low, so this is a life threat, okay? This is something to be concerned about. If the GCS is low, so by low I mean less than 8, for example, the patient will not be able to maintain their own airway. So what do you do in this situation? You go back to A, right? So currently we're at D, but you've done A, you've been happy with A, happy with B, happy with C. But during that time, once you've got to D, their GCS could have dropped. So if their GCS is dropped down to 8 or below, you circulate back to A. So that's something you have to remember and be very mindful of when you're doing disability section. The other thing you have to look out for in disability is, and this is the one most medical students and F1s forget, and that is glucose. You need to check their glucose. And the reason you need to check it is because 1, it's really fast to do, and 2, if it is low, you can reverse it really quickly. So if you have low glucose, that can mimic a catastrophic stroke. So you're there thinking that the patient's having a stroke, when in reality, you haven't checked their glucose. And all you had to do was give them a bit of sugar and they would have got better. So it's really important that you check the glucose in the disability section. This is the one that most people forget, and that's why I've put 2 lines underneath it so that you don't forget it. So under disability, the 2 things you need to do is, how I remember it is 2 Gs, GCS, and glucose. Those are the 2 things you need to remember under disability. So disability is a quick brain check. So because it's quick and there's only a couple of things under it, people sometimes skim past it, but it's one of the most important ones, because if the patient has a low GCS or a low glucose, that can be life-threatening for them. Well done, you've done A, B, C, and D. Now we have to do the final one, which is E. And E is exposure. So for exposure, the reason we're doing it is to make sure that we've been thorough, that we haven't missed anything out. So for this stage, we have to fully expose the patient. And I think it's very important to mention here that you have to maintain the dignity of the patient. That's very important. The other thing is you have to make sure that they're kept warm. These are two things you need to make sure you're doing under the exposure section. So what are the things that we look for when we've fully exposed the patient, maintained their dignity and kept them warm? One of the things is any hidden rashes. Because remember, these are signs or symptoms that we could have missed when we were doing ABCDE, which can actually play an important role in coming up with the diagnosis for the patient at the end. So hidden rash, that's one of them. The other one could be a bleed, like a minor bleed that you've missed. Third one, needle stick mark. So these are examples of things that could go missed, and that's why we have to fully expose the patient and make sure that we've been fully thorough and haven't missed a single thing. Right, so we've done A to E. You're happy with that now. Hopefully you see it as a system rather than a mnemonic. So when you're attending a crash call or you're with an unwell patient and your mind goes blank and you freeze, you have this system to come back to. Hopefully you understand what to do at each stage, because now you know why you're doing it. So we'll quickly go through it. With Airway, it's either opened or closed, and if it's closed, you need to fix the cause of why it's closed. So there's 3 things that you need to do. One is suction, one is head tilt, chin lift, the other one is a nasopharyngeal airway. For breathing, what do? If there's an issue with breathing, that means that their O2 sats will be low and their rest rate will be high. So how do we solve it? We give high flow oxygen. Circulation, that means their heart rate is high, their blood pressure is low if there's an issue with circulation. So we give 2 large bore cannulas and then give a fluid challenge. Disability, this is the one I told you have to remember. GCS, glucose. If the GCS is less than 8, you need to go back to Airway, because with a GCS less than 8, they can't maintain their own airway. Check their glucose. It's a fast test and sometimes it can mimic a catastrophic stroke. So if their glucose is low, you just correct their glucose and they should be fine. So for disability, you can do AVPU as well as GCS. And exposure, fully expose, but make sure you maintain dignity and keep warm. And in this section, you're looking for things like rashes, bleeds, or needle stick marks. That is your fast A to E system that you need to rely on. Whenever you're with a critically unwell patient, your mind goes blank, just go back to this. And I'm going to say it for the last time, do not go to the next one until you're happy with the one before. Hope that was useful. Stay calm, stay confident, and I'll see you in the next one.